Okay, so this is part two of our conversation on, well, actually going through the label sheets. We've gotten through the front and back of the full skeleton, and we've gotten through the vertebral column. So that leaves three sheets that we need to work through to make sure that you have a little bit of background information and that you have them labeled correctly. So the sheet that I'm moving into now is going to be of the rib cage. So it's 15.5 if you look at the figure number at the top of the page, and then it is page 110 if you look in the bottom left-hand corner. So with this particular view of the rib cage, when you look at number 1, that is referring to the first 7 pairs of ribs. So from the top of the rib cage down to that 7th pair, those would all be what we call true ribs. And what they mean by true ribs is when you look at the ribs, they actually originate on the vertebral column. So they form a joint with each vertebrae on the backside. And then they come around to the front of the body. And when you get to the front, before they ever reach that sternum, they actually turn into cartilage. And that is called costal cartilage. And once they make that transition into cartilage, it's going to be that cartilage that forms a joint or a union with the sternum on the front side. Now, if that connection is one-to-one, meaning that you have one rib, transitions into cartilage, and then connects to the sternum, that is what's going to make it a true rib. So it's a one-to-one connection. When we get down to number 2, those are called our false ribs. And what happens with the false ribs, they still originate on the backside, they still come around for the most part, but when they transition into that costal cartilage, they fuse together. And you can see when you get into those final 5 sets of ribs that it's now no longer that one-to-one connection, that they all kind of fuse into a piece of cartilage together and then make their connection to the sternum. So that is the difference between what we would classify as a true rib, where it connects independently to the sternum, and our false ribs, where they are going to fuse together before they make that connection to the sternum. Now, there's always an exception to the rule, and if you look at your ribs, you'll notice that 11 and 12 never quite make it all the way around to the front. So for 11 and 12, as far as the numbered ribs go, those are what we call our floating ribs. They are still classified as false ribs. So 1 through 7 are going to be our true ribs. 7 through 12 are all considered to be false. But 11 and 12 get a special designation because they do not ever come around to the front side of the rib cage, and they do not connect to the sternum. So number 9 on your label sheets of what you had to fill in, those are actually referring to your floating ribs. But please understand that they are still into that category of being a false rib. Now, the reason that you have those floating ribs is because of the protection that you need for the kidneys. So it extends the rib cage down in the back of the body so that those kidneys get a little bit of protection. They're not completely covered, but the top portion of the kidney is going to get a little bit of that bone protection. But what it does on the front side is it eliminates that bone structure from extending down further into the abdominal cavity. And if you think about it, if you feel where your ribs end now, and then think about 2 more ribs from each side coming into your rib cage, extend down another 3 or 4 inches. That puts you almost down to your belly button area. And now thinking about having bone through that area of your body and how much it would restrict your movement. Things like bending over to tie your shoes, picking something up off the ground, trying to pull on a pair of pants. If you have another 3 to 4 inches of bone that is going to limit your movement, those activities become much more difficult than what they currently are. So this is a very important design feature of the body, that we get that extra protection for the kidneys in the backside, but we don't limit or restrict our movement when it comes to the front side. When you get to number 3 is actually referring to the thoracic vertebrae. And the way that you can tell that that is a thoracic vertebrae is that it has a rib connected to it. So any time that you have a vertebrae that is making a joint or a connection to a rib, you know that that is in your thoracic region. 12 sets or 12 pairs of ribs, and each one of those is going to form a joint with a thoracic vertebrae. Now, I'm going to hit number 7 first. 7 collectively is referring to the sternum. So the sternum is that plate of bone that you have on the front side of your chest. 4, 5, and 6 talk about the individual parts because there are actually 3 individual pieces that come together to make your sternum. So for number 4, that is what is known as the manubrium. Now the manubrium means shield. And if you look at that piece of bone by itself, you can see that shield formation and how it gets its name. For number 5, that is the long slender piece in the middle, that is known as the body. And then for number 6, that is the pointed piece that you have at the very end, kind of forms the tip, and that is the xiphoid process. Now the xiphoid process means sword. And if you look at that tip, you can see how it does look like the end of a sword. And this is the bone that we have to worry about when you are doing compressions or if you are providing CPR to somebody. Because if you don't find the sternum correctly and you are doing compressions too low, you're actually running the risk of doing compressions on that xiphoid process. And if you put too much pressure on that xiphoid process, you can snap it and push it down. And now you're going to have this pointed bone that is pushing down into the soft tissue. And every time you do a compression, you're driving that xiphoid process into the underlying structures, which is not what we're doing, because at that point you are doing more harm than help for that person. So when you do compressions, you want to use your hand, find their rib cage and trace it up until you find the sternum. Once you find the sternum, that first hand that you used should stay put. Because if you're tracing up until you find the sternum, the first part of the sternum that you're going to run into is that xiphoid process. If you leave your hand there, you leave it on the xiphoid process. You take your second hand, you put it above that first one, and now that ensures that you are directly on the body portion of the sternum and that you are not on the xiphoid process. So you've used that first hand, locate the breastbone itself, but you leave it there because that's going to, like I said, make sure that you are correctly positioned and lined up to do compressions fully on that body portion and that you're not going to break that xiphoid process down into the person. So 4 is the manubrium, 5 is the body, and 6 is the xiphoid process. Number 8 is referring to the cartilage, and that is the costal cartilage. So we already talked about 9, but that costal cartilage, that's going to make up that flexible portion of the rib cage so that when you guys inhale and exhale, you have the ability to allow that rib cage to expand and contract as that air volume changes within the chest cavity. Now, before I go on to the last 2 sheets that we have, one thing that I want to point out, we've talked about the skull, we've talked about the rib cage now, and we've talked about the hip region. If you think about the design of all 3 of those, they are very rounded in nature. So the skull makes a complete case around the brain, rib cage makes a complete case around the heart and the lungs, and the hips are going to make a case around the reproductive organs. So in those places where we have our most vital organs, our brain, heart, lungs, and our ability to have a generation past our own, our skeleton has actually designed itself in a way that those areas are going to be very highly protected. So when you look at the skeleton, if a bone is rounded, that is an indication that it is a protective bone. If it is long and straight, that is an indication that it is a movement or a structural bone. So there is a design difference within the bones of our skeleton, and it gives you an indication as to what the job of that particular bone is actually doing for the body. So if it's rounded, it's protecting. If it's long and narrow, it's moving us from one location to the next. All right, so moving on to the image of the hand, figure 16.5 should be page 118 if you are looking at the bottom. So with this particular one, again, we're going to make a couple of adjustments because you are going to be responsible for knowing all 8 of the carpal bones. So this particular image filled in the hamate and the pisiform for you. You are going to need those for the final exam. So please put numbers to those, make those 13 and 14. Doesn't matter which one you make, 13 or 14, just as long as you are aware that on the test, you are going to need to know and be able to identify the hamate and the pisiform. They are not going to be filled in or provided for you. So looking at the bones that we have of the hand, you have the 8 carpal bones, and they were named, as I mentioned the other day, for things that they reminded people of or what they looked like. So on this particular sheet, number 1 should be your scaphoid, that boat-shaped bone. Number 2 should be the capitate, the captain bone. For number 3, that should be your trapezoid. 4 should be the trapezium. 5 would be the collection of the wrist bones or the carpals. 6 would be the metacarpals. 7 would be the phalanges. You are not going to be responsible for identifying the radius and the ulna. Those will be on your sheet for you, so you do not need to worry about filling those in. Number 8 is going to be the lunate bone, the lunar or moon-looking bone. For number 9, that is the triquetral or triquetrum, either one, both are acceptable. And then hamate already filled in for you, and pisiform also provided for you. You have 10, 11, and 12, which are going to be the individual names for the phalange bones. For 10, that would be your proximal phalanx. For 11, that would be the intermediate phalanx. And for 12, that would be your distal phalanx. So those are the bones that you guys have for the hand. And that takes us to our last sheet, which is going to be the bones of the foot. And this isn't too far away since we just went through those in the lecture portion. But number 1 should be the calcaneus. 2 should be the talus. 3 should be your cuboid. 4 should be the navicular. 5 should be your lateral cuneiform. 6 should be the intermediate. 7 should be your medial cuneiform. 8 would be your proximal phalanx. 9 would be the intermediate phalanx. 10 would be the distal phalanx. And then for 11, those would be your tarsals. 12 should be the metatarsals. 13 would be the phalanges. Now, I realize I went through those a little bit quickly, but the nice thing about being on video is that you guys can pause it while you're writing them out. If you have any questions on any of this, please do not hesitate to send me an email. I am trying to check my email quite often, more than I did before, just so that I can follow up and take care of questions as they might come up for you guys. Like I said, we did a little bit of online, but it was every other week. Now having to do it every single week makes things a little bit different, and I understand that. So if you need anything, please don't hesitate to reach out, ask questions. I will get those taken care of as quickly as I possibly can. And right now we are scheduled to be able to meet starting next week. So the college had extended things through April 3rd, which is this Friday. We will kind of see what happens. They just extended the social distancing through April 30th, and I don't know if that's going to impact us as well. So right now I'm just kind of in a holding pattern, and as soon as I know a little bit more and hear how the college is going to respond to that, then I will let you guys know how we're going to proceed with things. So like I said, let me know, ask questions, and I hope you all are doing well.